Hello, I'm Lyle. I'm a business coach and marketing strategist for Designed for Winners and Digital Success Advantage. Today I'm here with Dr. Kainth of Maple Primary Care in Plano, Texas. Thanks for being here, Dr. Kainth.
Thanks, Lyle. I appreciate being here.
I love to hear how businesses get started and hear their motivations, the strategies that brought them to the successful business they're in. So let me ask you, how'd you get started in the medical field?
Well, that would go back to my childhood. I grew up with two brothers who had chronic illness, and so I ended up being a caregiver at a very young age. And I was able to see how much of an impact it can be on families as well as patients to have a good team of doctors, nurses, medical assistants, the whole medical team. So that's how I got interested. And then to be sure that I actually wanted to do it, I did some volunteer EMT work when I was in college, and that kind of cemented it for me, and I went for it.
Some EMT work, what was that like?
That was exciting stuff, and really, really steep learning curve and really good learning, honestly. Unfortunately, lots of car accidents, which can be very traumatic, but some happy things as well. I delivered my first baby as an EMT, so that was fun.
Really?
Yeah.
That's cool. Yeah, you always hear about the bad side of things. It's always good to hear the good side of things too.
Yeah.
And as a doctor, you're in a primary care, you have your own practice. Why didn't you just go with an established company or join a hospital or something like that? Why'd you strike out on your own?
It's a really good question. And, I was part of a large healthcare company before. And what I found is that I didn't feel like I was a doctor anymore. I felt like I was kind of a glorified data entry person, and I just didn't have enough time with my patients. And in my opinion, that's the most important thing, is actually having time with my patients, building a rapport, but also working on lifestyle changes instead of just, prescribing medication. So that's why I decided to branch out. There's a high, what they call burnout rate of primary care doctors.
Right.
And it's because of these type of things. We don't feel like we're actually making a difference anymore.
Mm, I can imagine that. So what was that toughest part about getting started for you?
Honestly, the toughest part is taking the leap, just doing it, because it is something different. Most primary care doctors are working for large healthcare organizations for many different reasons. There is a secure feeling in that, you know that you will have a decently full patient panel. You won't have to work too hard for that. Will have benefits. Whereas when you go independent, it is literally all on you.
Hmm. What was the scariest part about that for you personally?
Personally, benefits for me were a big deal. Healthcare benefits, having good insurance is something I've always had. So that was a luxury. Once I was out on my own, I had to make adjustments to that. So that's something I work on literally every year. I look at what my options are and see what would be best for me for that year.
Wow.
Yeah.
Yeah, I'm sure that was scary.
It is scary, but you know what? It's doable. And that was the great thing about it, is there's so many different ways of being able to take care of your health and getting it paid for and thinking about it. I love that there's options. And so it was honestly a good learning experience too.
That's great. Now, how long have you been in practice now?
I have been in practice now for 17 years.
17 years. Goodness.
Yes.
So
Yeah.
think far back, 17 years ago, little Dr. Kainth getting her own practice going. What was that first week like for you?
Well, luckily, I wasn't little Dr. Kainth at the time. I started my own practice independently about 6 years ago now. So it's not too far in my rear view anymore. And, there was always a mix of nervousness and excitement, nervousness, like, what the heck did I do? Was this the right decision?
Right.
But excitement in that, hey, I can make this whatever I want, These are my decisions and I can change things on the fly. I don't have to get approval from the administrators or the higher ups. I can just go with this.
There's a little bit of excitement, sounds like, huh?
Yeah, yeah, definitely.
Excitement, when the excitement overwhelms your fear, that's when it's fun.
True. Hey, I like that.
So, how'd you get your first patients? Tell me about that process for you, because you just open up the doors and everybody just comes flooding in, right? Isn't that how it works?
Oh, I would love that to be the case, but it was not the case. So, as I mentioned earlier, I was with a large healthcare organization. So, I already had a really large patient panel there, close to 25 to 2,800 patients. But when you move from a large healthcare organization, oftentimes you have to go a fair distance away because of a non-compete clause. So, my practice ended up being a good, I believe, like 9 miles away. But I had a lot of loyal patients, and some of them followed me. And that's what kept me afloat at the beginning. And then from there, it just kind of builds.
Yeah. And what'd you do to get those first new patients that weren't part of that previous system?
Yeah, so I waited until my last official day, and then the very next day, I mailed out letters to all of my patients,
Mhm.
and that helped. And I already had, so I did get my ducks in a row, because I already had a website up, for myself, and I was able to take phone calls already. So I tried to have everything in a row before I sent those letters out, because just sending the letters out is probably not the best idea. It's best to have some kind of plan where patients can actually get a hold of you.
Mhm. That makes sense. And so you moved to practice, you're a little bit farther away and everything. So what'd you do to establish your practice in that specific community?
So, first thing was just getting up and open. So, opening the doors, getting signage. Signs are important. People need to know that you're real and that you're out there. A website is absolutely important, as you know. That's kind of people's first impressions of you. So, getting that up and running, getting all the communication together also, that all of those things established my practice. But then I also did, a couple of extra things, which is opening up a chapter of Walk with a Doc, which is a program that has been started around the country initially and then around the world. And it's to help promote the community to get more active, to incorporate movement into their lifestyle. And so I love doing that. That's once a month, and a group of us get together and we go for a walk.
Yeah. And do you do anything to promote that event, or is that just in your practice only?
No, I do. I have, Facebook events, and, it's on my website. I promote it to all my patients. I encourage them to bring family, friends, and canines, of course.
Canine's good. Yeah,
Yeah,
you're a dog mom, aren't you?
I am. I am. Yes.
All right. So if somebody was thinking about starting their very own practice, what are 3 tips you would give them?
Number one would be learn how to do everything yourself. During training as a doctor, we are always trained to just be a doctor. Just use your energy and your mind to be a doctor, only be a doctor. But when it's your own practice, I highly recommend learning to do everything on your own. Learn how to schedule your patients, learn how to answer the phone, learn how to do your own EKGs, learn how to do your own point of care testing, learn how to adjust your website, learn how to post things on social media, learn how to bookkeep. Those are all very basic things. And the top thing to learn is learn how to bill. Nobody is going to care about your money like you will. And that's something that's really important. Learn how to bill and learn how to collect. Don't rely on somebody else to do it. So that would be number one. That was a long answer.
Yes.
Uh, Number two would be to gather a good team around you. You really can't do it on your own. We want to think that we can do everything, but it is really best to leave certain things to professionals. So I highly recommend working on getting a good team, such as getting a good accountant, getting a good lawyer that you trust, and getting a good, marketing digital strategist. I think that's important. You may not need that right at the beginning if you didn't want to, but at least somebody to build your website. It's not something that you want to do on your own because you don't know all the details. Let's see. Third thing would be to strive for good enough with a lot of things.
Mm.
So as doctors, we are perfectionists, and that's how we've been. The only thing I want to say is, be a perfectionist in your trade, in being a doctor and your quality of medical care. That's where you should put your perfectionism in. But everything else, strive for good enough, because patients, honestly, the most important thing to them is that interaction with you and their patient care. So things like, for example, the waiting room, some docs kind of make the mistake of making it super fancy and having like a waterfall, feature and, a snack station and things like that. Know that you don't have to do that. Like, patients really are good with just having excellent quality care and a good environment, but it doesn't have to be perfect, because also there's no such thing as perfect. So, sometimes think about striving for good instead of perfect.
Makes sense. And it sounds like that interaction between you and your patients is very important. What do you do to build that bedside manner for yourself? And
Yeah, I mean, this is the prime reason I started doing what I'm doing. I do a membership based model. And so that allows me to have time with my patients. So I block out an hour for each of my patients. And that gives me time to get to know them, to get to know their family, to get to know what their healthcare goals are. And I love it. It's why I went into medicine.
that's cool. And if you were to go back to 18-year-old Dr. Kainth, what was one thing you would tell her?
Well, I wasn't a doctor yet at
Right.
18, but I was thinking about it. But what would I tell her? I would tell her that it's a privilege to do what you're doing, to get to know people and take care of people, sometimes at their most vulnerable times, is a privilege.
That's awesome.
Yeah.
Thank you for your insight. Thank you for being with me here online. If anybody has any questions or anything, how do they get in touch with you?
Yeah, so I'm easily available. My website is mapleprimarycare.com, and my email address is info@mapleprimarycare.com. Um, all my um, all my contact information is on the website, and I'm also on Facebook. I'm on YouTube, so please find me.
Cool. Thanks again for being here, and you have a great day.
Thanks, Lyle. I appreciate being here.